Panic attacks are persistent, really intense feeling of panic or feeling like you're going to die in a situation. So it's often characterized by really heavy breathing, difficulty breathing, your heart racing really fast, sweaty palms, there can be some gastric distress. Panic attacks can often become panic disorder. Panic disorder is generally when you will have panic attacks without warning, without trigger. It doesn't necessarily need to be at a specific time or place or event. So people with panic disorder will tend to avoid a lot of places where they have previously had panic attacks, and they will also try to avoid anything that will trigger a physical symptom that they feel will be a precursor to a panic attack. So people with panic disorder will avoid things like exercise or caffeinated beverages because both of those things will get their heart rates up and may make them feel like they're headed into a panic attack. So panic attacks are treated with exposure response prevention, and more specifically interoceptive exposure. So the exposure piece is essentially allowing people to begin to go to places and do things that they'd previously avoided because of their panic attacks. An interoceptive exposure is along those lines, but a little bit different. It's actually exposure to the physical symptom around the panic attack. So it may be, doing some exercise to get your heart rate up or drinking one of those caffeinated beverages. And the goal of these exposure therapies is really to allow the client to learn to tolerate distress and learn to live with the feelings, the physical feelings that may be associated with a panic attack, and not necessarily have one.